Hello friends, this is Hassan Naveed again at Madison College in Wisconsin. We're going to continue talking about the respiratory tract, and we will talk this time about the trachea. The trachea is known as the windpipe. The trachea is about 11 centimeter in length. It runs in the thoracic cavity, so it's intrathoracic. The trachea transmits air from the nasal cavity or the oral cavity to the lower respiratory tract and helps in distribute the air into the two sides of the lung, right lung and left lung. Let's take a look at the anatomy of the trachea. The trachea travels down its length, which is about 11 centimeter, up to the level of the fifth thoracic vertebra. The trachea, as you see, is formed of rings. These are known as the tracheal rings. Each one of these is a C shape. I'm going to turn it around to show you, and it's open at the back. So in the back, it's kind of open, which is a horse shoe shape or a C shape structure. It's a cartilaginous tube that keeps the airway patent or keeps the windpipe patent and helps the transmit of air. It is part of the conductive system of the lung. The trachea will split into two main bronchi, right main bronchus and left main bronchus. If you take a look at the right main bronchus, it is wider, it is shorter, and it's straighter than the left side, which is a little curved up. So that makes it easier for inhaled or aspirated substance to lodge into the right side of the lung. So that means aspiration pneumonia tend to be common or more common in the right lung than the left lung. As we mentioned earlier, the right lung divides into three lobes: upper, lower, and middle. Based on that, the bronchial tree is distributed that way. The divisions of the trachea and its branches and bronchioles down the lungs is known as the bronchial tree. The bronchial tree will divide further. The primary bronchi, right and left main bronchus, will divide into secondary bronchus. So this is the primary bronchus. This is the secondary bronchus. The secondary bronchus will divide or lead to tertiary bronchi, and the tertiary bronchi will lead into the terminal bronchioles. Terminal bronchioles and turn will divide into respiratory bronchioles. Terminal bronchioles and respiratory bronchioles are microscopic structures, but here we can take a look at the branches and divisions of the right side. For example, this is going to be the apical, and this is going to be the posterior. It's in the back, while this is going to be anterior. In the other side, you're going to find lateral, and you're going to find medial branches of the tertiary bronchioles, and so on the right side and the left side. Also, it divides according to the lobes of the lungs. This is to ensure delivery of oxygen to all lobes of the lungs. The trachea is lined up with mucus-secreting ciliated epithelium that helps to trap microbes, to trap foreign bodies, dust that might enter through the respiratory tract. It have walls, and these walls form the lumen and protect the lumen of the trachea. It does have epithelium, it does have submucosa, mucosa, and it also does have a cartilaginous layer that is formed or is structured from hyaline cartilage. We're going to take a look at the microscope and find the details of the histology of the trachea. But we're looking at a section of the wall of the trachea. I'm going to start from inside. This is the lumen of the trachea right here, and this line, this is the epithelial lining of the trachea, of the mucous membrane. So this is an epithelial lining. When we put it in a high power, you're going to see the details of the pseudocolumnar epithelium that lines up the mucous membrane. It's ciliated also. The line underneath it, this is the basement membrane, and the layer underneath is the lamina propria. Lamina propria, this is a loose connective tissue that is underneath the basement membrane. The whole thing is known as the mucosal layer. So this is the mucosa, or the mucosal layer of the trachea. Underneath you're going to find, in the lower layer, this is the submucosa, and the submucosa got some glands that secretes mucus. It is shown up here. I'm going to put it a little higher so you can take a look at the other layers that we know. Taking a look at it, this is the layer of the hyaline cartilage that you see. So here the submucosa, underneath it you're going to find the hyaline cartilage. Notice the chondrocytes and the lacunae. They are found inside the lacunae here. As you go further, you're going to see the chondrocytes gets a little flatter and form the epicondrium here in this area, while this is the chondrocytes or the hyaline cartilage. I'm going to put it for you in a second in a higher power to show you the details of each of the layer. I'm going to start from the top. This is showing the lining, the epithelial lining is pseudocolumnar epithelium. Look at it. Look at the nuclei at different levels. And look at the tall columnar cells that's staggered on each side. Look at the cilia. It is ciliated epithelium, and this is at the inner lining of the trachea. This is the lumen, again the white area, the lumen, and this is the ciliated area showing the epithelium, the pseudocolumnar epithelium. Look at the lamina propria underneath it. The second line here, this is the lamina propria, or the basement membrane actually. The line is the basement membrane, and underneath it is the lamina propria, which is loose connective tissue. So the loose connective tissue fibers scattered somewhere here in the bottom. This is the submucosa, and in the submucosa you see here, these are the mucus or the mucus secretory cells or glands of the trachea, and that keeps the trachea moistened and keeps the moisture and keeps the mucous membrane secretions of the trachea flowing. Another very nice glandular structures here, more prominent in the submucosa, and these are the mucosecretory glands of the trachea we just talked about, more prominent. Look at the gland structure and the lumen of the gland, and these are found in the ducts that secretes this substance that lubricates and keeps the trachea moisture. We're gonna go up a little or down a little bit to show you the hyaline cartilage, and this is the second layer, the last layer that is we're gonna look at and find. Here it comes. This is a layer of the hyaline cartilage, very beautiful chondrocytes in the lacuna, the lacunae, see them scattered, and this is the layer of the mucus of the chondrocytes or the cartilage of the tracheal wall. And if you see at the chondrocyte, the more we go up towards the submucosa, they become more flatter and they tend to be a little thinner, and these are known as the perichondrium. I'm going to go a little bit up to show you the perichondrium. These are the perichondrium. They become flatter. If we go on the side to show you, let's go right and left to show you more of these perichondriums, and these are the perichondriums that we find. The last layer and the trachea is going to be way towards The outer part, more chondrocytes. You see them here, very typical shape. You want miss them. If we adjust the focus a little bit, it's a little blurry here, and to show you the chondrocytes. Thank you for watching the video, and I'll see you in another time.